A very warm good evening to our viewers. Welcome to the Evening Review Show. I'm Matthias Aufiko, your host for tonight's show. I'm joined in studio tonight by Ms. Kapena Tjombonde. She's the CEO of the Namibia Institute of Pathology, better known as NIP. Of course, you might have read about them in the papers recently. Yeah, you might also have heard about the work that they do in the pathology space in the country. So one of the key SOEs in the country as far as delivering healthcare is concerned. Ms. Tjombonde, good evening and welcome.
Good evening and thank you for having me.
It's indeed a pleasure to have you here. Well, NIP, some people might be wondering, what is this NIP that we're reading about? What do they do? What is the work of this company? And perhaps just a brief summary as to what your organization does and what its mandate is.
Yes. So the NIP was established by an Act of Parliament in 2000. And NIP stands for Namibia Institute of Pathology. Mm-hmm. When the Act was passed in 1999, NIP then opened its doors in 2000. So you may want to know what is pathology services. Mm-hmm. We render laboratory services. Laboratory services are services where we collect blood samples from patients, primarily from patients. We test them in the lab, and then we deliver results to the doctor. Mm-hmm. The doctor, on occasion, will be waiting for these results to decide what's the course of action, what's the medical plan, in order to determine better treatment outcomes for the patient. So NIP is located at 36 laboratories mm-hmm. Across the 14 regions of our country, and we are serving over 400 public healthcare facilities. That includes district hospitals, 31 district hospitals, mm-hmm. and the rest are public healthcare, centers in the regions like clinics and all of that. Mm-hmm. We serve about 82% of the Namibian nation, which is the population that uses public health services, and we employ about 500 staff members, of which 75% are technical staff, befitting because we have to test all the time, 24/7.
Mm-hmm. Okay. So how much of a job is this operation? What does it entail in terms of challenges? Perhaps what are some of those that you can list that are giving you and your team headaches every day when you go to work?
Yes. So when I took office in 2021. We had to formulate a strategic plan. Mm-hmm. So we really took time to do an analysis of what the business is, what is the plan going to look like in order to inform and to be responsive to the challenges that we have. So during that time, we've established that our testing platforms, 80% of our testing platforms have aged. Mm-hmm. They are beyond useful life. That's big challenge, number one. The second one is that our sample transportation network is not optimal to make sure that NIP renders the quality service and on-time service that is required by the clinicians. In addition to that, one of the big challenges that we have is also the supply chain management challenges that we have. All our commodities that we're using are imported. We don't manufacture anything in Namibia, and unlike the revelation of last night, mm-hmm. that we are now 3 million in the country, mm-hmm. we still are a very small population in comparison to other nations, for example, that are manufacturing commodities. Yeah. And so because of our economies of scales limitation, it really puts us in a challenging situation. Mm-hmm. One other challenge is also the fact that we are a public enterprise and we have to comply to the Public Procurement Act. Mm-hmm. And as an essential service provider, sometimes we really struggle to get the commodities on time because the procurement process is protracted, and they are also kept as far as thresholds are concerned. Yeah. And often we have to refer, the bids to higher authorities. Mm-hmm. What we've also seen over time is that our volumes are increasing. Commensurate to that, mm-hmm. based on the challenges, that I spoke about, our capacity may not always be commensurate, and therefore affecting our turnaround time. Mm-hmm. So those are the challenges. But what we've done from a successes point of view, what we've done is that in formulating our transformational strategy, we have formulated an instrument replacement plan, right? So just to make sure that we improve our testing platforms and we renew them, we get modern testing platforms, and our plan has started yielding results, and we have a couple of testing platforms that we've replaced so far.
Yeah.
Of course, we still have a long way to go, but at least we've received some new testing platforms. We've also, with the very topical 18 vehicles that we procured, is really to optimize our transportation, the transportation of our samples. That's also part of the transformational strategy that we are implementing. From a supply chain management point of view, we have realized when we did the assessment that we needed skills in the supply chain management. We now have a senior manager who really we hope is going to turn around that space within the next 6 to 12 months. When we are challenged with the procurement process, the policy unit and the minister has been kind to us to grant exemptions. And so that's how we are trying to traverse the public procurement space. It has served us right so far.
Yeah.
Although those ones that we are running according to the timelines often take a bit long, but it's our country, we have to comply to our processes.
Yeah. You've mentioned issues around the procurement and so on, and also mentioned some successes. But there's this perception that it seems that the private sector seems to be moving well as far as operations and timely delivery of these services is concerned. Is it just a perception, or is there any truth in that?
Yes. So, Matthias, public sector and private sector are not comparable. I earlier mentioned that NIP serves about 82% of the Namibian population. Private sector, therefore, is 18%. That's number one. The client base is smaller than compared to the public sector. Number two, we are subjected to the Public Procurement Act. Private sector is not subjected to the Public Procurement Act. They probably have their own procurement policies, and I know that their procurement policies are more efficient compared to the process that we have to follow. And therefore, you would notice that if they are needing a commodity today, they can get it today.
Yeah.
When NIP needs a commodity, we have to follow those processes and get it at the time of completion of that commodity. So it may look as if, it is true that private sector is more efficient, they operate better because they have favorable procurement processes as opposed to what we have.
Yeah.
But we have a deficit that we are trying to close, and we have to plan better in order to make sure that we close all the gaps that we have. And it is not impossible to operate at the level of private sector. We can, but for us it's a journey right now.
Yeah. Of course, I was reading on social media, also, especially when this car saga broke out, where some people are saying that doctors prefer sending their samples to private laboratories and so on. So would you say it's a fair analysis? And coupled with that also, there are several SOEs who would partner up perhaps with universities and so on to ensure that their needs are already sort of taken care of from a ground level. You mentioned that you import most of the commodities. What are you then doing in that space to maybe to see, can we work with the UNAM to see maybe this type of fluids that we need for our samples, we can produce them locally? What are you doing with regards to that?
So I'll respond to that question in two ways. The one is to your latter question, in terms of trying to create local industries to manufacture and produce our own commodities in country. We are hard at work with a big project, and I'll speak to you when the time is right.
Yeah.
I will not speak to you about that right now. But with respect to partnering, yes, we work with universities and all of that, but from a research point of view. What we want to do as an institution is we want to get our basics right. If we get our basics right, then a partnership will make sense. So once we get our basics right, we improve our testing platforms, our turnaround times improve, and we are able to render the service, we improve our service standards, then we can partner. And it's really part of our transformational plan to partner with local institutions and also international institutions to make sure that we up the game at NIP. It is work underway.
Yeah. So in terms of benchmarking, and I'm sure those are things you do when you do perhaps your operational reviews and so on. If you look in the region, where is it that the NIP can still improve, and in which areas are we sort of doing well?
Yes. So like where we've traveled so far, mostly it's South Africa, maybe because we have a lot of alliances with South Africa. We've gone to South Africa to understand the operations, the challenges, and to see how we can improve our service here. South Africa is a big operation, and they have a lot more specialized skills. Of course, the population is bigger and it's commensurate to that. In terms of the comparison with NIP, South Africa's turnaround times are much better. They have more skills. So if, for example, if there are specialized tests that we are supposed to perform and it's not cost effective, we refer to them. They perform all the tests. They probably have very, very few tests that they may be sending to the US or so to test. But from a capacity point of view, they are more capacitated. They have a lot more specialists. Their processes are refined, and the output is much better. And that's why we benchmark with them. We have an agreement with them. And we also have an agreement with another private lab in South Africa where we are learning from them in terms of process optimization, workflow analysis, and making sure that service standards are improved.
Just before we head to the break, and this question will lead me to our topic after the break, and I'm sure it's what many people want to hear about, the vehicle scheme. But before we get to that, the issue of sustainability. I know there has been this talk of SOEs being so overly dependent on government. What are you and your team doing in that regard to ensure that self-sustainability is on the top of your menu going forward?
You may remember that most, if not all, public enterprises were departments within the ministry. And it is because they were rendering a service that is required by the Namibians from the government. The public enterprises then have been formed to be autonomous entities, but still continue to serve the public interest agenda. Like, for example, we play a huge role in the health sector. From an efficiency and sustainability point of view, in our mandate, we can provide services to both public and private sector. So as we are setting ourselves up to improve our services for public, we are also gearing up to diversify and be more sustainable from a private sector point of view. I spoke to you that the private sector share is 18%, but we have a diversification strategy that we are busy implementing. And again, like I said, because we are operating in a competitive space, this is not the right time to speak about that. But rest assured that our intention is not to remain over-reliant on the public, but also just to help ourselves from a sustainable point of view and having alternative revenue streams.
Mr. Tjombonde, we'll head for a short break quickly, and we'll be back to continue this conversation. And to our viewers, we head for a commercial break. Stay tuned. Well, we're back from the short break. Well, of course, we spoke about the operational matters, the challenges, the successes, and so on. Ms. Tjombonde, I'll be failing my viewers if I don't talk about the things that were making headlines the past few weeks, the vehicle scheme. And I know your team has been hard at work trying to provide responses as to why certain things were done the way they were done. And of course, there's been outcry as to how is it that this company decides to give its executive cars at this time while it's claiming that there are still challenges that need to be addressed and those things. Can you briefly give us insight into the thinking of the decision?
Yes, Matthias, I think from the word go, I just want to reassure you that NIP is very, very serious about governance. We uphold governance principles. And so in light of that, because the remuneration of executives is not something that the directors can just decide about. There is a Public Governance Act. With that comes a lot of regulations and directives, and the executive remuneration is also governed under the Public Enterprises Governance Act, as well as the directives associated with that. So as an institution, we uphold and we try to comply all the time.
Yeah.
So with that, I just want to reassure you and the public that the introduction of the executive vehicle scheme followed the governance process from the principle up to implementation. That's number one. Secondly, the vehicle scheme is not unique to NIP. It is practiced that at the level of executives, there is some sort of incentive from a vehicle scheme point of view. And thirdly, Matthias, this discussion around introduction of the vehicle scheme of the executives started in November 2022. It is not a discussion that started in 2023. It didn't start in 2024. It started in November 2022. So you can imagine the application of mind and just really being thorough in terms of which scheme, what, and when. So that process was, due diligence was done, process was followed. The public must be reassured that governance is upheld at NIP.
Well, as much as you speak governance, there are those that would say that, but is it a priority factor right now, considering where the company is?
And again, as I mentioned, it's not a decision that was taken today, introduced today. It was not abrupt. There was a lot of application of mind. And if not now, when is the right time?
Yeah.
That's the question that I always ask. If not now, when is it going to be the right time?
Yeah.
Right. So again, we are confident and comfortable that there was a proper application of mind over a period of time, more than a year. And so with the introduction of this process, we are confident and comfortable that it was well thought through.
Yeah.
Yeah.
Of course, now the issue of let's move to the issue of the buying of the cars. That one was another one that threw the company in the spotlight, where specifically the price was 18 million. That really raised eyebrows within the public to say, did the company get value for its money for this amount, considering the number and type of vehicles that were procured?
Yes. So I earlier spoke about our transformational strategy. I spoke about specimen transportation. And I also spoke about how widespread we are in the country. I also mentioned that our infrastructure is aging. So the purchasing of this vehicle is part of that. It's a decision that was taken in alignment with the implementation of our strategy. Now, why leasing versus outright buy? So in every institution, before you implement a decision, you look at many, many factors. NIP being so vast, these vehicles will be on the road all the time. And so at the end of time, they are finished because they were on the road all the time. picking up samples, delivering, picking up results, delivering to the clinicians. So you can imagine at the end of the lifespan how these vehicles will look like. Now, from the CAPEX investment point of view, the total investment is 11 million over 4 years. It is not a once-off amount. That's number one. Secondly, the vehicles that appeared in the picture was just not for illustration. It is true, it's part of the cohort that we bought. But there's a mix of vehicles. There are double cabs, there are single cabs, there are Corollas, and then these famous vehicles that brought about the outcry of the public, and understandably so. So if you take 11 million divided by 18, you will come to this 600 and something per vehicle. And if I was a public member, I would probably also respond the same. But what was not clear, probably what was not explained, is that yes, it is 18 vehicles. They are not all the same type. They are more expensive vehicles, even more than 600,000, almost 800,000, which were about 8 or 9. In addition to that, we also installed tracking devices in all the vehicles, and that's part of the cost. It's the fleet will be managed because it's a lease. The fleet will be managed by the service provider. That also comes at a cost. Maintenance, repairs for tires, replacements, and all of that is also part of their cost. So the 11 million is not just the acquisition of the vehicles, but it comes with a lot more services as part of the package. And so we hope that justifies the 11 million, because it includes a lot more benefits. And NIP, we want to focus on our core business, saving lives. We don't want to be managing fleet and also, doing our core business. So if you're able to have partnerships that assist you to render your service, why not?
And maybe just from a broader perspective, and this probably goes for other SOEs also, lessons learned from this as to how public enterprises should go about communicating their work with the public to avoid similar incidents. Because I'm sure if the information were probably brought out in a different manner or more detailed, you wouldn't be having to write press statements day and night to defend the company.
Correct. No, it is a lesson learned. We had a debriefing just to analyze as to what went wrong, because this, you can technically say it's PR went wrong. The intention was to tell the public that NIP is improving its service, and as part of that, we have procured 18 vehicles. We are going to distribute the vehicles to the regions to make sure that we're able to pick up your samples, deliver them to the lab, and give the results back. But in that, it played out the way it is. So there are many, many lessons to be learned from that encounter. One of which, when we communicate about the improvement of service, we have to be very specific, and we have to say what we mean. So that we don't create this negative image about the institution, because the intention of this notice to the public was to reassure them that NIP is improving the services, not to create an impression that we don't know how to spend the money. So again, is that precision of information, and also just making sure that our PR practitioners, not the media houses, understand our work. That's one of the things that we are going to do. We are going to invite the media houses to just take a tour of our labs, understand our services, understand the impact of our work, because this PR that didn't go too well can potentially impact the confidence of stakeholders in our work, and that is the least we want to think about. Yes.
Well, lessons learned. This is Mr. Tjombonde. Mr. Tjombonde, we'd like to thank you for coming through today, and we'll wait for that invitation to come and tour your labs. And rest assured that we'll keep you on your toes if something else comes up.
Happy. We are a public institution, and we are happy that you invited us. And we welcome another invitation to come to your studio. To the viewers, stay put. We are transforming the game.
Thank you very much. Well, to our viewers, that's Ms. Kapena Tjombonde, CEO of NIP. Thank you very much for staying tuned this evening. See you again tomorrow, same time, same place.